A provider who allegedly commits federal health care fraud may face exclusion, meaning they could be banned from billing federal health care programs. Instead, the provider can choose to settle the case and may need to enter into a corporate integrity agreement, or CIA. A CIA is an arrangement between OIG and the provider that outlines requirements the provider must fulfill to continue participating in federal health care programs.
It's not always in the Medicare program's best interest to exclude a healthcare provider, because then the provider is no longer able to treat Medicare patients. In that case, we can enter into a CIA as a way to protect the Medicare program through the OIG's oversight of the provider while continuing to allow the provider to treat Medicare beneficiaries.
A recent example of a CIA occurred in September 2017 with ANmed Health, a hospital based in Anderson, South Carolina. ANmed Health resolved allegations that it had violated the False Claims Act by submitting false Medicare claims. The hospital agreed to pay more than $7 million and entered into a 5-year CIA with the OIG. The terms of CIAs vary depending on the facts of each case, but the agreements share some elements.
All CIAs have certain basic requirements. For example, the ANmed CIA requires ANmed to have a compliance officer and compliance committee, written compliance policies and procedures, a training plan, a risk assessment and internal review process, a disclosure or hotline program through which employees can report compliance concerns, and a screening process to prevent the employment of excluded individuals. The ANmed CIA also requires ANmed to retain an independent review organization to conduct an annual review of claims submitted by ANmed to the Medicare program. The ANmed CIA requires the submission of an initial implementation report and annual reports detailing ANMed's compliance activities each year during the term of the CIA.
CIAs affect how providers function after settlements, but these agreements can also impact people who receive care.
They require providers to implement compliance programs to prevent and detect fraud even after the term of the CIA has ended. The OIG believes that providers that integrate compliance with their day-to-day business operations operate more effectively and efficiently, and ultimately provide better care to patients.